Welcome to Healthcare Channel. Hyperhidrosis is a medical condition characterized by excessive sweating that affects approximately 3% of the population. It can have a significant impact on an individual's quality of life, causing embarrassment, discomfort, and even social isolation. Fortunately, there are effective treatments available for hyperhidrosis. In this video, we will discuss the various treatments for hyperhidrosis, their effectiveness, and their potential side effects. 1. Antiperspirants. Antiperspirants are the first line of treatment for mild cases of hyperhidrosis. They work by plugging the sweat glands and reducing sweat production. Over-the-counter antiperspirants usually contain aluminum chloride, which is the active ingredient that blocks the sweat glands. For people with more severe cases of hyperhidrosis, prescription-strength antiperspirants may be necessary. These contain higher concentrations of aluminum chloride and are usually applied at night to dry skin. Antiperspirants are generally safe, but they can cause skin irritation and itching. It's essential to follow the instructions carefully and not to apply them to broken or irritated skin. 1. Medications. Several medications can be used to treat hyperhidrosis, but they are usually reserved for people with more severe cases. These medications work by blocking the chemical messenger acetylcholine, which stimulates the sweat glands. The most commonly used medications for hyperhidrosis are anticholinergics, such as glycopyrrolate and oxybutynin. These medications can be taken orally or applied topically as a cream or gel. However, they can cause dry mouth, constipation, and blurred vision, among other side effects. Beta blockers, which are commonly used to treat high blood pressure, can also be effective in reducing sweating. They work by blocking the effects of adrenaline, which can stimulate the sweat glands. However, they can cause fatigue, dizziness, and other side effects. 1. Eye interferesis. Eye interferesis is a non-invasive treatment that involves applying a mild electrical current to the affected areas of the skin. The electrical current temporarily blocks the sweat glands and reduces sweating. Eye interferesis is usually performed using a machine that applies the electrical current while the affected areas are submerged in water. It's a safe and effective treatment, but it may take several treatments to achieve optimal results. It may also cause skin irritation or discomfort during the treatment. 1. Botox. Botox, also known as botulinum toxin, is a neurotoxin that blocks the release of acetylcholine, the chemical messenger that stimulates the sweat glands. When injected into the affected areas, it temporarily reduces sweat production. Botox injections are usually administered by a dermatologist or a cosmetic surgeon. The treatment is quick and relatively painless, and the effects can last up to 6 months. However, Botox injections can be expensive, and they may cause temporary muscle weakness or other side effects. 1. Surgery. Surgery is usually reserved for severe cases of hyperhidrosis that have not responded to other treatments. There are several surgical procedures available, including endoscopic thoracic sympathectomy, ETS. This procedure involves cutting or clamping the sympathetic nerves that control the sweat glands in the chest. It's an effective treatment, but it carries a risk of complications, such as lung collapse or nerve damage. Sweat gland removal. This procedure involves removing the sweat glands from the affected areas. It's a more invasive procedure than ETS and carries a higher risk of complications, such as infection or scarring. Surgery should only be considered after other treatments have failed, and it should be performed by a qualified surgeon with experience in hyperhidrosis surgery. In conclusion, hyperhidrosis is a common condition that can be treated effectively. Thanks for watching.